In the name of Allah, the most beneficent, the most merciful. To draft diet for CKD patients, certain points must be kept in mind. Kidney patients are prone to develop cardiovascular events like stroke. Therefore, the monounsaturated fats should be included in their diets. Plant oils such as safflower oil or canola oil are healthier than animal fats such as butter or beef fat, tallow. Hydrogenated vegetable oils should be avoided because they are rich in trans fatty acids. Monounsaturated fats are a healthy alternative to animal fats. The extra fluid raises blood pressure and puts a strain on the heart and kidneys. People with advanced CKD should avoid salt and salt substitutes that use potassium because CKD limits the body's ability to eliminate potassium from the blood. Thus, US Food and Drug Administration advises that kidney patients should limit their daily sodium intake to no more than 1500 milligrams per day. So, back to drafting of diet plan. Whole grains are an important source of micronutrients and fiber. These should be included in the diet of kidney patients. Damaged kidneys allow potassium to build up in the blood, causing serious heart problems, especially in hypertensive kidney patients. So, low potassium fruits are preferable. High potassium and high phosphorus vegetables should be avoided, and low potassium vegetables should be preferred. Next are the miscellaneous food items. Any foods with high phosphorus like milk, curd, cheese, cola, canned iced teas, and lemonades, egg yolks should be consumed with caution. Kidney patients need to limit their protein intake because amino groups released from protein catabolism are converted to urea in the liver, which is excreted through kidneys. So, urea generation puts strain on already weakened function of the kidneys. High protein foods like ground beef, shrimp, salmon, tuna, chicken breast, roasted chicken, processed meat, canned meat, hot dogs should be replaced by lower protein alternatives like freshly cooked stews or lentils. Diet plan can be devised by filling in the portions in my plate. To fill in portions in my plate, three things must be kept in mind. Number one, which fruits are suited for kidney patients due to low potassium, sodium, and phosphorus content. Secondly, how much quantity is allowed per day. And thirdly, how this quantity may be divided into 3 or 5 servings per day. The recommended allowance per day may be noted from my plate website. For fruits, 2 to 2.5 cups of fruit are required per day, and this may be divided into 5 half cup servings per day or 3 by 4 cup servings in a day. Now coming to the vegetable portion of my plate. For this, we list the vegetables which may be consumed by kidney patients with special emphasis on low potassium vegetables. Then the recommended amount is noted from my plate website, which recommends 2 to 3 cups daily, whereas it defines a cup as 1 cup of raw or cooked vegetables or 2 cups of raw leafy salad. Dividing 3 cups into 3 meals makes 1 cup of raw or cooked vegetables per meal or 2 cups of salad greens per meal. Next, coming to the grains portion, the grains are listed. Recommended portion from my plate is noted, which is 3.5 to 5 ounce equivalents for whole grains. Quantity of 1 ounce equivalent is noted from my plate recommendations. As a rough estimate, it may amount to 1 slice of whole bread per meal. Low protein diet should be added in protein portion of my plate. Likewise, breakfast may be designed by picking up recommended food items with special preference to fruits low in phosphorus and potassium. Similarly, lunch may be designed from recommended food items. Similarly, dinner can be designed. Combining all portions together may look like this. So, diet of a kidney patient should be low in proteins, sodium, potassium, and phosphorus. Now coming to CKD patient on dialysis. Such patient will not require protein restricted diet and the patient can consume proteins as per my plate recommendations. So carry home points are that kidney patients need to be careful in selection of food and should avoid diets rich in sodium, potassium and phosphorus. Total protein intake for a CKD patient should be reduced, whereas kidney patients on dialysis are not required to observe protein restriction.